Hey everyone, today I'll be talking about generalized tonic clonic seizures, also known as grand mal epilepsy. Now, these type of seizures have three stages. First is the pre-ictal phase. By ictal, I mean seizures. So before the seizure starts, patient can experience symptoms like abdominal pain, nausea, and palpitations, wherein the patient can hear his or her own heartbeat. Next stage is the ictal stage, wherein actually the seizures occur. This stage is further divided into two stages. First is the tonic stage, wherein the tone of the body increases, and this stage lasts for around 10 to 15 seconds. Herein, the patient acquires decorticate positioning, as you can see in this diagram, wherein the flexors of upper limb and extensors of lower limb are affected, due to which the position known as decorticate position is acquired. Also, there is versive head turning, and that occurs due to extensors of neck being affected, and that is followed by an ictal cry. This ictal cry occurs due to intercostal muscles and adductors of larynx being affected. After that, the patient goes into the clonic stage, in which he or she suffers from the jerks of the seizures, and this stage lasts for around less than a minute. Once the seizures are over, then the patient goes into a post-ictal phase, wherein first he or she goes into a flaccid state and then become unconscious. Once they regain consciousness, they are confused. And then slowly, when things start to resolve, they experience headache for some period of time. Apart from this, also during the post-ictal phase, the patient experiences urinary incontinence. So these are the events which occur during a generalized tonic clonic seizures. Once again, I'll brief out these things for you. Here is the overview. When generalized tonic clonic seizures start, initially there is a pre-ictal phase wherein patient experiences symptoms like abdominal pain, nausea, and palpitation. Then comes the ictal phase wherein the actual seizures occur. Initially, there is a tonic stage in which the tone is increased. Patient acquires decorticate position, wherein the flexors of upper limb and extensors of lower limb are affected. There is versive head turning due to extensors of neck being affected, and there is an ictal cry due to intercostal muscles and adductors of larynx being affected. After that, patient experiences the jerks in the clonic stage. Once the jerks are over, patient lands in post-ictal phase, wherein he or she goes into flaccidity. Initially, the patient is unconscious. On regaining consciousness, the patient is confused, and then there is a headache lasting for some time. Also, the patient experiences urinary incontinence.